Elsewhere now, 2 doctors in the United Kingdom are suing the government over a lack of personal protective equipment, otherwise known as PPE. They claim that Britain's guidance on protective gear is not in line with WHO standards, exposing frontline medics to infection. And additionally, healthcare workers were told last week that plastic aprons could be used in some cases instead of protective gowns. The doctors are demanding an urgent review of PPE guidance. They say it's the government's duty to protect healthcare workers. But Britain's Health Minister, Matt Hancock, has denied that doctors have been asked to compromise on safety. He says PPE guidelines are based on clinical advice. And for the latest from London, let's speak to Ollie Barrett on this. So, Ollie, is the suit viable? And is this a sign of more such legal action ahead, given, as what we know now, a shortage of medical resources?
Always difficult to predict how cases will play out through the legal system. I think it's fair to say with this one that legal minds believe it has limited chances of success. Certainly the 2 doctors involved do believe, though, that bringing the case can also bring more publicity to the issue. And that might apply to other potential cases too, that doctors, nurses, other healthcare professionals might decide to try and go down this route to try and shine a further spotlight on the issue.
Well, Ollie, on the issue of the provision of this equipment, we know that the UK has missed out on a number of opportunities to procure adequate medical supplies. Why is it taking, why have they struggled to do this?
Well, one of the reasons is simply that there is this huge global demand for PPE equipment. Britain is not the only country that has at times struggled to get exactly what it wants and when it wants it. Now, critics here in the UK say that the government has also missed some opportunities in terms of manufacturing PPE here in the UK. Others say that it has been sending too much PPE that is manufactured here in the UK abroad and is allowing it out of the country to other nations that need it. The government insists, though, that it is taking every opportunity that it can, that it is working with other countries on major shipments in recent days from Myanmar, from China, from Turkey as well. But there is that huge global demand. The government is also trying to paint a picture here in the UK of a national picture, and saying that actually, if you look nationally, day to day, there is the right amount of PPE equipment here in Britain, but admitting that there are localised pinch points. So hospitals, healthcare settings, care homes up and down the country on an individual basis who are coming to a shortage and trying to get hold of the right equipment. And it's those individual settings that we are sometimes seeing doctors, nurses, healthcare workers complaining about. The Chief Medical Officer, Chris Whitty, has spoken in the last couple of days about believing that the government is doing everything that it can, and that nationally the picture is not too bad. The difficulty is that you need millions and millions of items every single week, and so this is not a struggle that is going to be won on a daily basis, or you can put an end point to, really.
Yeah, Ollie, speaking of the government doing all it can, well, we know that the government has pledged to ramp up testing. Do you have any update on that front? Because we know that the goal was for 100,000 tests a day.
Yes, and in recent days we've seen capacity being ramped up significantly here in the UK, but then the problem that capacity of testing has not been used. We've even seen episodes in recent days where the number of tests being carried out has fallen. Now, as of today, we have a different system in place. So key workers and families of key workers up and down the country, not just healthcare workers, but people like bin men, people like journalists even, if they have symptoms, can now log on to a government website and apply for a test. That is part of the strategy to make sure that the capacity that is growing is actually used here in Britain. Today, day one, the website has reached capacity already and has closed down. Now, some will say that's a bad sign, that the capacity isn't growing fast enough. The government will say, look, that's a good sign. We now have rising demand for the tests that we want to carry out. The government is insisting that it can hit that 100,000 target by the end of the month. But it's a very tall order indeed.
All right, thanks for that. Ollie Barrett speaking to us from London.